Welcome to our essential guide on airway devices. We'll cover everything from face masks to the critical endotracheal tubes. Airway management is foundational to medical practice. Let's start with the most common and non-invasive tool, face masks. A face mask is a simple device allowing gas administration without internal apparatus. It's crucial for initial ventilation. Key parts include a transparent body for observation, a sealing cushion, and a connector. Specialized types include the pediatric Rendell-Baker-Suchek and endoscopic masks. Proper technique involves the one-hand method, using the jaw thrust to maintain a seal. Be aware of complications like nerve or eye injury and gastric inflation. Next, let's explore artificial airways, starting with the oropharyngeal airway, or oral airway. The oral airway maintains a patent airway by preventing the tongue from obstructing the throat. The Goodell airway is the most common type, featuring a hollow channel for air exchange. Sizing is estimated from the mouth to the angle of the mandible. Insertion usually involves placing it upside down and rotating it 180 degrees, or using a tongue blade. Moving on to the nasopharyngeal airway, commonly called a nasal trumpet. This airway extends from the nose to the pharynx and is better tolerated in conscious patients with intact reflexes. Remember to lubricate it and insert with the bevel facing the septum. Risks include nosebleeds. Now we address the laryngoscope, essential for viewing the larynx during advanced airway procedures like intubation. The primary function of the laryngoscope is to provide a clear view of the vocal cords, which is necessary before inserting an endotracheal tube. The blade contains the light source. The curved Macintosh blade lifts the epiglottis indirectly, while the straight Miller blade, often used in children, lifts it directly. To achieve the best view, position the patient in the sniffing position, involving lower neck flexion and head extension to align the oral, pharyngeal, and laryngeal axes. Finally, we discuss the endotracheal tube, or ETT, which conveys gases directly into the trachea. Key features include Murphy's eye, a side opening to ensure airflow if the tip is blocked, and the cuff system, which seals the trachea to prevent aspiration. We prefer high-volume, low-pressure cuffs. Standard sizing includes 8.5 millimeters ID for adult males and 7.5 millimeters ID for adult females. For pediatrics, a common calculation is age divided by 4 plus 4.5. Proper placement requires the tube to sit in the middle third of the trachea, typically 2.25 to 2.5 centimeters below the vocal cords in adults, confirming effective ventilation. We've covered the essential airway devices, from non-invasive masks to critical ETTs. Mastering these tools is vital for effective airway management.